So yeah, I was 20 years old. It was 2019, and I was in the States at the time studying at university, and I played football. So like bearing in mind we fly to our games, America's huge, so we'd always fly to games. We'd never like travel on the coach. So I flew from London to Pittsburgh in around July time of 2019, and I had a really weird pain in my groin. And obviously, being a footballer, I've had like groin injuries before, but it just like felt really peculiar. I remember flying with my mum and like saying to her like, I don't like feel right. I just felt quite funny. So we just kept monitoring it, and then the groin pain kind of went away. And then come to October time, I just had like quite a lot of trouble breathing in games and stuff. And went to the team doctors and told them, and they didn't really know what was wrong. We thought maybe I had a cold or something. It was getting towards winter time out there, so they just kept an eye on it. And then in the last week, roughly of October, we had a game in Florida, and I'm in Pittsburgh, so it's quite a long flight. And we flew back, and the next morning I started to cough up blood. And then obviously we went to the emergency room. But as soon as we went in there, I remember my physio saying it could be a PE or it could be like a DVT kind of thing. But I remember the nurses and the doctors kind of disputing with her that I'm too like young and healthy for it to be that. So they didn't do like the correct test that they should have done. They didn't do like the CT scan, any of that. They just did like an X-ray kind of thing, and they saw that my lung was, I don't know the correct terms, you guys obviously do, but like they just saw that there was a lot of scarring from the X-ray and stuff. So they just kind of diagnosed me with pneumonia. And I went home the next day, and then the next morning I still kind of started to cough up blood. So we went back to the emergency room, and my physio at the time, she like demanded that I got the right kind of tests, which I did. And then so I had a CT scan, and it was showed that I had like clots everywhere in my left lung, and so like it was pretty extensive, and then a few in my right. And like I remember the doctors at the time saying like it lit up like a Christmas tree from the scan. And then I just remember going to my floor to meet the doctor, and he was like, obviously I was like in tears. Thought my career had kind of ended. I didn't know what the future was going to hold. Like at that point, my parents were in England, but I just remember the doctors being like so intrigued to meet me. And it was just really confusing because obviously I didn't want to be in the hospital or anything, but because they'd never had someone of 20 years old come in with PE before. Um, so yeah, it was quite a strange time, and I had no clue about PE, DVT, anything like that. But at that time, I was on the contraceptive pill, and that was just to control my periods with football because I just hate to play when I'm on, kind of thing. But I never was told that that could have been a risk factor, or maybe I was too naive to like read the leaflet or talk to my GP further about it. And I know it's a small chance, but it's still probably what had caused it. So then I was put on a 6-month treatment plan. So I was put on blood thinners for 6 months, but because obviously I was in the States and I had quite good medical care, they wanted to do like repeat scans at 3 months to see if it was a acute PE or chronic. So at 3 months, it showed that the clot hadn't, none of it had kind of dissolved, none of it when it was still kind of present. So then obviously that was now a chronic clot. And then they, for my heart scan, they thought for some reason that, well, it was like it was, I think, a fellow is what they call it in the States, who was doing my scan. And I was basically misdiagnosed at the time at 3 months. And I was told that I needed heart surgery because they thought the clots were blocking the blood flow to my heart, and they thought that my heart was expanding. But normally, like being an athlete, I think there's cases of like athletes having like enlarged heart. I think just about the pressure that they put on in training and stuff like that. So I was told I needed heart surgery, and I'd never play again. And then 2 weeks later, I got a call saying that I'd been misdiagnosed. I don't need this. It's fine to continue with the medication, with the blood thinners. And I wasn't training at the time because obviously I can't train on blood thinners. But then COVID happened, and then I had to come back to England, obviously, because everywhere went into lockdown. So when I came home, I went to the Montefiore Hospital, which is in Brighton, and and had like the 6 months checkup, and they said that well, my doctor had said that I was now like fit and healthy, and he thinks I could come off the blood thinners because the clot had kind of gone, but not a lot. So he thought it would just kind of be there now for like, I don't know, till it goes. I can't remember the exact phrases he used. But I was lucky enough to have like quite a good hematologist in Pittsburgh. His name was Dr. Bontempo, and like he was like really known in Pittsburgh, and he had a lot of people that fly all around America to come like to see him. And I had a lot of good treatment out there, but he said that it was basically caused by the contraceptive pill and the flights that I had taken. Obviously, I played for England as well, so we always flew to our games. Like I played in the World Cup in Jordan. We had to fly, we had to get many flights there, and we'd have to play like the next kind of day, next 2 or 3 days. So yeah, I was misdiagnosed twice because of my age, I think, and me being like fit and active, especially the first time when they said they thought it was just pneumonia. And I'm so grateful my physio kind of demanded I went back and had the right test, because it might have gone on for ages. But now I'm fit and healthy, and I'm still playing football. I'm playing for Charlton at the minute. And I just kind of want to spread awareness as well, because I've not met someone who was my age when they were diagnosed with PE, but obviously working with Thrombosis UK and with Joe, like I kind of seen more people my age who have been diagnosed, but it's still quite rare. So that's why I suppose I'm on this call with you guys today. So that's it.
Thank you very much, Hollie. There's nothing that replaces having a personal perspective, and it's obviously been an emotional roller coaster, especially given your career. Hopefully we'll get some questions through on chat, but I'm just going to start off with a question while we're waiting for that. So if you were giving one piece of advice to doctors who see patients who come into medical units with possible pulmonary embolism or breathlessness, in terms of how they interact with you as a patient at a time when you're quite vulnerable, what would be your top piece of advice to the doctors about how they approach these situations?
I'm not really sure, because obviously I was in the States at the time, and they were obviously, I don't know, there's probably no difference, but American doctors, and they kind of at the time, the first day I went in, they refused to the physio that they would do the test, because obviously like it's, you know, they don't want to do the CT scan because it's quite dangerous as well. I don't know, but I suppose just maybe to them I would have said take it a bit more serious, like football's my at the end of the day. I was in the States to play football. Considering I was 20 years old, maybe it wasn't taken as serious because I was still walking into hospital fit and healthy. Whereas when I went in for checkups, I'd be in a treatment room with people like with breathing things, who would have actual difficulty breathing, where I'm still like fit and healthy, being able to walk in, probably still laughing and joking. But I'd probably say to those doctors who had seen me, maybe perhaps take it more serious. Like I was still 20, but that didn't mean anything different. And then I suppose, because I didn't even know like the contraceptive pill, I didn't actually, the onus is probably on me, because I should have probably looked at it in more depth, and I was younger at the time, a bit more naive. But maybe to have that more of a conversation about it, because that I had the genetic testing to see if I had any genetic factors, and I had none of those, so it's probably just the possibility of the pill combined with the flights. So maybe just talk in depth. You don't have much time, but I don't know, just potentially say what's happened, because I was so shocked, so I didn't have a clue.
Yeah, I mean, I think listening to patients and communicating clearly are sort of fundamental principles of how we work every day. And I think the story you're telling really emphasizes the importance of doing that. So I can see Will's put a comment on the chat saying that a lot of our young patients want to talk to someone else who's young and who has been through the VTE journey. Should we signpost them to Thrombosis UK? And I think on that note, those of us on the panel who look after patients with thrombosis regularly would definitely say that, although it's less common, we do see patients of your age sometimes who've had blood clots, so we know it is an issue, and it's not something that we see exclusively in older patients. So what would you suggest to other young people who are starting out on the same journey that you've been on in terms of how they could get support?
I'd say obviously it's Joe as well, but definitely like go through Thrombosis UK, because I want to share my story. That's why I'm here today. And I want to talk to like other people about it. And especially, I suppose, young females as well who are going to the GP kind of, because you hear all of this with everyone like scared to get the vaccine for COVID because of blood clots, whereas girls are actually taking the pill and have and don't have no clue really that that could be a factor. So I suppose just I'd say to people who are my age and going through it, just talk to people, and when you start talking, you find like some more common ground, and then you're going through it with each other, I suppose. But that's the reason I messaged Joe when I got home, because I wanted to work with Thrombosis UK, and I wanted to share my story and connect with other people, because it's always interesting, and it helps, I think, massively.
Yeah, I can see you've done a lot of great work in raising awareness, because I Googled you just before I introduced you. And I probably didn't introduce you in a as flattering a tone as I should have in terms of your sport and credentials, having Googled you. But yeah, I can see you've done lots of media work about raising the profile of pill-associated clots, and about, you know, young patients having clots in general. So we have to be thankful to you for that, because that really makes our, you know, role much easier. And it's really important that we work together in raising awareness of these sorts of conditions. I can see Joe's just put a comment on saying that Thrombosis UK hears from a lot of young people who've had similar experiences. They don't expect to have a clot, and too often clots are not considered due to age. Yeah, I think that's correct. Does anybody else have any questions or comments that they'd like to either take themselves off mute to say, or put in the chat? I'll just give it a minute, because I normally move on too quickly, giving people time to type. Oh yeah, Raz.
Yeah, thanks, Jill and Holly. Yeah, really interesting and very helpful listening to you speak. I'm going to be speaking later, but actually nothing I've got to say can be put better in words than actually listening to you. I think the one thing I did pick up right at the end, though, is you almost sounded like you were taking the blame or responsibility for having been on the pill, and being naive and not being aware. I personally would try and encourage you not to feel that way. It is our responsibility when we start our patients on the pill to tell them about the risks, but it's not your responsibility, and it's certainly not your fault that you had a PE because you were on the pill. That was there to regulate your cycle, so that you could work, essentially. So I think it'd be really important that you don't sort of feel responsible. I think it's down to us as healthcare professionals to have considered the diagnosis and made the diagnosis and taken you through that journey. So that would be just something I just would like to sort of just reflect back to you, but also thank you for sharing your story.
So Will's comment says that we do refer people to GPs for cognitive behavioural therapy sometimes after venous thromboembolic events, and we know that, you know, psychological complications are understandably very common, and asking if anyone has any experience of receiving CBT or psychological support, or referring people for that after DVT or PE.
Can I just add as well that certainly at the charity, almost everybody we hear from has had an impact from thrombosis, but often this is more severe in younger people because it comes as a shock and it often comes as a delay. So actually getting information, but also being listened to at point of going in for diagnosis can really seem to help and reduce that anxiety that can build afterwards. And just like Holly, not blaming herself.
Yeah, I mean, we definitely see patients in clinic, because we would typically see patients at 3 months for review who come with a very long list of questions and have obviously been thinking about these questions since the point of diagnosis, which is, you know, a shame. And hopefully the charity and various other resources can help people in that time. But it's a long time to be reflecting on these various issues. Okay. I think we probably need to move on. So thanks again, Hollie. That was really helpful, and I'm sure very valuable to the audience to hear your story. I hope things carry on going well, and I'm sure we'll see your name in lights in terms of your career. Good luck with that.
Thanks, guys.